All right, now to the coronavirus crisis here in the U.S. More than 8.8 million Americans have now been infected by the virus, and more than 227,000 have died. Over the past week, the U.S. has been averaging more than 800 COVID deaths per day. CBS's David Begnaud reports tonight from Minnesota, where daily COVID deaths in recent weeks have doubled.
Tonight, hospitals in the Midwest and the Great Plains are overwhelmed with coronavirus patients, a 50% spike in the last month in the U.S. Hotspots are Michigan, Wisconsin, Ohio, Minnesota. Cases are on the rise there, and average daily deaths have doubled over the last 2 weeks. Take North Dakota. Over the last 7 days, they have reported the highest COVID death rate per capita in the United States, and one of the lowest mask-wearing rates in the country.
We're just seeing kind of these consistent high numbers.
Dr. Austin Simonson is a hospital physician at Sanford Health System in Sioux Falls, South Dakota.
There doesn't seem to be a lot of rhyme or reason to it. I have a 97-year-old who is doing wonderfully, and somebody much younger than that. We're not certain they're going to survive the day.
In nearby Wisconsin, many of the ICUs are at or near capacity. One of those patients in Wisconsin is Carmen Lerma. She is recovering from a double lung transplant after coronavirus destroyed her lungs.
It's not like a flu. It doesn't feel like a flu. I was pretty healthy. And look at me.
The federal government says if a vaccine is authorized by next month, they could start distributing to frontline workers and the most vulnerable people by the end of this year. Dr. Anthony Fauci.
If we get a vaccination campaign, I think it will be easily by the end of 2021 and perhaps even into the next year before we start having some semblances of normality.
But some states remain skeptical of the process. Washington, Oregon, and Nevada now say they will partner with California to independently review any FDA-approved vaccine before distributing it to the public. Tonight, we are in Minnesota, where the governor is telling people between the ages of 18 and 35 to go and get tested, because according to the governor, most of the new infections are being driven by that age group, and nor most of those people are walking around infected with no symptoms.
Really interesting, David Begnaud. Thank you.